So you currently work at Center for Health Progress. Before we get to your current role as Director of Political Strategy, what did you do as a policy manager and what did you do afterwards as a senior policy manager?
Yeah, so I'm trying to remember my timelines. So actually, a lot of this work that I've continued to work on started when I was at the Colorado Fiscal Institute. And there was an opportunity to work on a bill that, to your point about how do we address raising funds when we have TABOR, it was a bill that created something called an enterprise, which is a provision in TABOR where you can raise money. And it's money through a fee. And so in this case, a fee on health insurance plans and health insurance companies. And so that money partially goes to fund the OmniSalute program, which is coverage for undocumented immigrants. First program in the country that is private health insurance for undocumented immigrants. And so that's the program that's covered the first year, 10,000 people, the next year, 11,000. So I started working on that when I was at the Colorado Fiscal Institute because of the TABOR implications of it, and continued that work as I went to the Center for Health Progress. And then that first year I worked at Center for Health Progress, the Colorado option work began. And so that was where I really, as a policy manager, I worked on shifting really the conversation in the Colorado option to one that centers health equity. It centers communities of color, expanding coverage for undocumented immigrants, things that, were innovative. Like, I don't know, how are you going to make a health equity centered insurance plan? But I was like, it's important we have this legislation, this huge bill. When are we going to get another opportunity to try to do that thing? So that was a lot of what I did as a policy manager at the time, was focus on that and helping build up Center for Health Progress and our reputation at the Colorado Capitol.
Well, that's awesome that it would kind of like build off of the previous role into this role and then just really like digging deeper into the same work. And oftentimes that is what happens in public health, because the issues that we're dealing with are here for a long time, and like we need to be persistent in various different positions to kind of like get at them. You mentioned that you had to Google what a health policy analyst was. So you were a health policy analyst, you moved on to policy manager, senior policy manager. Maybe what are some of the key skill sets that you would advocate for someone that is interested in a role like those roles should try to attain?
Yeah, I mean, I as somebody who works with community members to get folks comfortable working in policy, I feel like everybody has the skills they need to advocate for themselves and their communities. There is a level of extroversion, even temporarily. Like, I can be very much an introvert on the weekends, but I have to be able to talk to people and like be passionate about things. There's writing involved. There's public speaking, testifying. Being creative, I think, is an underrated skill in policy, because like these things we keep saying, like innovative, first in the nation, like that wouldn't be a reality without having creativity that you're able to bring, because these are problems we have to come up with a creative solution to solve. And like an ability to work with other people, but also, again, going back to that, like having your values and what you believe in, because it's going to be a negotiation. It's going to be a fight often, and you have to know what you believe in so that you can work with people, but also not get swayed by the political winds.
That I appreciate that. I think that's important to really like have a values-based approach to the work that you're doing, and I appreciate you sharing those skill sets for anyone that is interested in getting into policy work. And I do also I say appreciate a lot, but I do appreciate you also seeing that everybody has like a part to play in the policy thing, because I feel like too often we say like, oh, it's for someone else to kind of deal with, and that kind of neglects the power that we have as an individual, as a community, to kind of collectively come together and say, these are the things that are impacting me, my family, my community, and these are the ways that I really want to advocate for that change.
Yeah, I mean, that's the most meaningful part of what I do, to me, is working with folks from communities who didn't see themselves there to challenge themselves to show up and be there. So I think we all have a role to play. That's what democracy is about.
Right, right. Yep, it's your tax dollars. We gotta be there to hold those systems accountable to how we can like make that impact and bring those dollars to the communities that kind of need them because they've been disinvested and marginalized for decades, if not centuries.